All right. Today we will be discussing respiratory system diseases and disorders. Some of you may have had some of these, or some of you may know someone that has had some of these. The respiratory system is very vulnerable to airborne pathogens because you're inhaling and exhaling with every breath. Can you remind me what a pathogen is again? A disease-causing agent, something that causes disease. Viruses, bacteria, fungi, those are typically what you can inhale. You're not going to inhale a parasite unless it's something really small. And you're probably not going to inhale a protista or a protozoan. So it's typically fungi, like fungal spores, bacteria, or viruses that are airborne. Some of the most disabling respiratory disorders are, and I'm not going to include things like the rhinovirus, which is your common cold. That's not disabling. You might have a sniffling nose and a sore throat for a week, but you'll survive. These others can be disabling and they can get progressively worse. So here we go. COPD. No one in second period knew what that meant. Does anyone in here know what COPD stands for? Nope. Not crippling. Chronic, obstructive, pulmonary. And when you hear pulmonary, what is in reference to? Lungs disorder. COPD. And as a kind of a side to that, we'll do emphysema, which is related to COPD. Oh, I spelled that totally wrong. Emphysema. There we go. Asthma. Has anyone ever had asthma before? Anyone still have it? Did you grow out of it, Jacob? Yeah, me too. Tuberculosis. Or TB. Then we'll do pneumonia. Anyone ever had pneumonia before? Were you young, Lillian? Okay, anyone else? I know someone who has a 10-month-old son who got it. They got it from daycare. We talked about how babies tend to get everything at daycare. When they're very young, their immune systems are naive. They got pneumonia and they brought it home. So mom and dad got pneumonia too. And then we'll finish it off with lung cancer. And I can actually talk a little bit about COVID-19, which is a disease that typically affected your respiratory system. All right. Now, before I do get started, I want to mention to all of you that COPD and lung cancer, what do you suppose it causes those? Yeah. COPD and lung cancer are proof of the devastating effects of tobacco smoke on the body. I have a hunch that if people could actually see their lungs, they would drop every cigarette that they would ever have for the rest of their life. When you get skin cancer, you tend to go to the dermatologist and get it cut out, but you can't see your lungs. But if you could, I think it would be changing a lot of behaviors. All right, so let's do the first one. COPD, chronic obstructive pulmonary disorder. The key feature in COPD is the reduced, and here's a scary word, irreversible decrease in the ability to force out air of the lungs. Your ability to exhale is diminished and it gets progressively worse. So when you inhale, your ability to exhale is just not great. More than 80% of patients with COPD have a history of smoking. That's 4 out of 5. It causes dyspnea, which is labored breathing. The dyspnea gets progressively worse. You tend to have frequent coughing and lung infections. We call those pulmonary infections. And finally, you tend to get to respiratory failure. You can't breathe anymore. You might have to be hooked up to a ventilator, which is a machine that can breathe for you. So it can lead to respiratory failure. There's a reason why. I'm going to get to all of this, okay? Respiratory failure due to hypoventilation. You are not breathing enough. You can't breathe enough. The hypoventilation is insufficient ventilation, which is insufficient breathing. Now, I want to see if you guys can fill in the rest of this based on what you learned yesterday. If you cannot properly exhale, like your ability to exhale the air from your lungs is very much reduced. If you can't exhale, then what gas is going to start to build up in your bloodstream and in your body, Dylan? CO2. So this means that you retain carbon dioxide. Okay, continue down this rabbit hole. If you retain carbon dioxide, what does that do to the pH level of your blood? It makes it acidic. And what condition does that lead to? It leads to acidosis. And it also leads to another condition where you have low oxygen levels. What is the prefix for low or not enough? Hyper or hypo? You can also get hypoxia. Hypoxia means low oxygen. Hypo means low, and oxy or oxia is in reference to oxygen. So there's really nothing great, or there are no perks to having COPD. And the majority of people that get it by far are smokers. Yes. Dyspnea. Yeah. Yes. Okay. Now, the next one is very closely related to COPD. It's called emphysema. Emphysema is the permanent enlargement of the alveoli and destruction of the alveolar walls, plural. What tissue makes up your alveolar walls? Do you remember? Simple squamous epithelium. Very good. It's so thin. And now because the alveolar walls are being destroyed, what will not be able to take place within your air sacs? You cannot do gas exchange. You can't breathe. Your body can't get oxygen, and you can't get rid of CO2. Patients of emphysema, or if you want to call them victims, that's fine. Patients are perpetually exhausted. They can't get a good breath of air. And I was doing some research, guys, when I was getting these notes ready for you. When you breathe, those muscles that you use to breathe, the actual muscles themselves, your diaphragm, your intercostal muscles, they use about 5% of all the oxygen you inhale. 20% of the oxygen you inhale with every breath goes to your brain. 5% just goes to your muscles for doing this. 5%, that's not a lot at all. But when you have emphysema, you have to use other muscles like your chest and your back to try to get as much air as you can. So you go from using 5% of the oxygen you need to breathe to 20 to 30%. So you need more muscles to actually breathe to the best of your ability. Your bronchioles collapse. The little branches that come from your bronchi, they collapse when you exhale. And because the bronchioles collapse, this leads to hyperinflation of the lungs. They can't get rid of their air, which is CO2. And this causes the diaphragm to flatten, which means it can't work properly. The diaphragm is curved. This makes it flattened. And finally, do you recall what chamber of your heart sends blood to your lungs? Think about the flow of blood. What chamber in your heart sends blood to your lungs? That's not a chamber. The pulmonary arteries are not a chamber. The left ventricle sends it to your body. The right ventricle does. Your right ventricle has to work harder and therefore gets larger, which is not a good thing. When muscles work harder, they get bigger. Like if you work out your biceps, they get bigger. That's good. You have big arms. But when it happens to your heart, not so great. The right ventricle works harder to pump blood to the lungs. And that causes it to enlarge. So COPD in emphysema. No one that has ever had that, it says it's not so bad. It's debilitating. You okay, Morgan? All right, the rest of these are going to be pretty brief, and we'll finish up with lung cancer, okay? Chronic bronchitis. Has anyone ever had bronchitis before? I had it once in high school. I think it was because I grew up in a house with smokers. Bronchitis is the inflammation of your bronchi. Whenever you see a word that ends in itis, bronchitis, appendicitis, laryngitis, gastritis, all those things, tonsillitis, it just means inflammation. Inflammation of the bronchi. You get it by inhaling irritants. And it leads to inflammation. And in this case, your bronchi just develop a lot of mucus to try to catch all of this crap that you're inhaling. And because you have all this mucus, you're going to have trouble breathing. It impairs ventilation and gas exchange. I remember, I think I was 16. I was a sophomore when I got bronchitis, and in football practice, I couldn't breathe. Impairs ventilation of the lungs. And so we went to a doctor and he said, you can't practice for a week. You got to let this clear up. The typical causes are smoking and pollution. And I didn't smoke in high school, but my parents did. So I probably got secondhand smoke, where you inhale other people's smoke. It can affect you. All right, 3 more. Asthma. Jacob said he had asthma. Does anyone else in here used to have it and you grew out of it? No? My parents tell me I had it, but I grew out of it too, just like he did. This is reversible. Jacob and I are living examples of that. It's typically triggered by allergies. When we did the immune system, I taught you guys allergies. Basically, allergies are where your immune system thinks that something that is totally harmless, whether it be pollen or penicillin, it thinks that is bad. And so it is going to attack it as if it were a pathogen. And one of the ways you attack the pathogen is to trigger the inflammatory response. So if you have an asthma attack, what's basically happening is the cells in your throat are becoming inflamed because your cells in your throat think that what you're inhaling is bad. It really isn't bad. Pollen isn't going to kill you, but your body is confused. And so it causes an inflammatory reaction. And do you remember what the 4 signs of inflammation are? Heat or warmth, swelling, redness, and pain. The swelling is what I want to talk about. How would you describe your ability to breathe if your airway starts to swell up? Yeah, the airway becomes narrower and your ability to breathe is going to be challenged. So when you have an asthma attack, the immune system triggers inflammation of the airways and it narrows your airways. It causes reduced airflow. Medical devices like an inhaler have a medicine inside of it called a bronchi or bronchial dilator, and it opens up your airways again. It kind of has a counter effect to the swelling. But when you have a full-blown asthma attack, your lungs are closed. Air cannot go in and out. All right, 2 more. Actually, 3 more. Tuberculosis or TB. TB can stand for Tampa Bay or Tom Brady, but also means tuberculosis. When the Devil Rays first came out, they weren't the Rays yet, they were called the Devil Rays in 1998. Most major league teams have the name of the city on their hat, like New York has NY, Boston has B, San Francisco has SF, and so on. Well, we had TB, but we also had the stingray on it. And some people are like, well, why can't we just have TB? Because the owners were saying at the time, we want people to see TB with the Ray, no, we mean Tampa Bay. If we just put TB by itself, we're going to think that we're team tuberculosis, which eventually they got over in 2008. They just had the blue hats with the white TB that you guys see nowadays. The thing with tuberculosis, however, is that it is caused by bacteria. I remember the first job I got out of college, I had to get a tuberculosis test because it is highly contagious. And if you have it, you can spread it. And so they had to test me to see if I had TB in my system. Have any of you ever had to get a TB test? No? Good. You spread it by coughing. And because it can spread by coughing, it enters the body by inhaling air. Symptoms include fever, night sweats, weight loss, nasty wet cough, and you could possibly cough up blood. And because it is a bacteria, what would you use to treat it? Antibiotic. Well, guys, as you learned, because it is a bacteria and because we have been overusing antibiotics for the last 70 plus years, what do you think some strains of tuberculosis have done? They have evolved. And so there is antibiotic resistant TB out there in the world. All right. Got two more for you. Second last one, pneumonia. Lillian, do you know how you contract a pneumonia or pneumonia? You got a flu shot? A lot of younger kids get it. I shouldn't say a lot of people, but if you were to get it, it's often when you're younger, when your immune system is weaker and you got a bunch of just snotty, nasty kids spreading it around. It can be caused by a virus, a bacteria, or a fungus. Your airways become inflamed. And here's the nasty part. Your alveoli actually fill with fluid. And that fluid could be mucus. It could be interstitial fluid. It could be pus due to infection. And then I'm going to put another one. I'm going to say other. I'll tell you what that other is after we finish our last one. So just keep that one in mind. And finally, the last one, lung cancer. Lung cancer is the leading cause of death of men and women in North America. Well, they associate a lot of it with heart attack, but the heart becomes strained due to lung disease. About 90% of cases results from smoking. This was the argument that my own mother would put up when I would say, Mom, you have to quit smoking. She could say, I could get hit by a bus tomorrow. Or your grandmother, my mother, used to smoke her whole life and she never even so much as coughed. Okay, she's the 10%. She's the minority. If Mason walked across Del Mabry blindfolded during rush hour to Steak and Shake and he made it to the other side, that is not an indication that everybody can do it. You know, a broken clock is right twice a day. He got lucky. There's not a rule in the rule book of life that says that bad things only happen to bad people. There can be people that live a good, clean life and they can still get something like lung cancer. It happens. But by far, 90% of the lung cancer patients are smokers. Safe to say that they're correlated with each other. Lung cancer can be aggressive, which means it's really tough to fight. It metastasizes. Do you recall what that term means? It spreads. It metastasizes rapidly and widely. So lung cancer can spread to other areas of your body. It can do it pretty quick. And as I said earlier, you really don't know you have something until it's too late. Lung cancer is one of those things. It's typically diagnosed when it has already become advanced. All right. You are done writing for now. So take a break. And I want you guys to pay attention to the screens. I want you to see some of the imagery I want to provide you with these different ailments, okay? And we can even go into a bonus disease, COVID-19. So let's switch over to the internet. Let's go to Google and let's type in, come on. All right, COPD lungs. All right. There is no cure for COPD. And the damaged lung tissue doesn't repair itself. However, there are things you can do to slow the progression of the disease, improve your symptoms, stay in the hospital, and live longer. Treatment may include a bronchodilator, which is an inhaler, to help open your airways. So let's take a look at some images, okay? Ooh, boy, does that look healthy to you? Looks like a fruitcake. Let's take a look at this. It's like a good reference. Where is it? Must be hard to find. All right, let's see. In a healthy lung, your bronchial tubes are clear, your alveoli expand and collapse with each breath. Oxygen moves through the air sacs into the blood, that's external respiration, and CO2 moves into the air sacs to be exhaled, again, external respiration. Whoops. Now let's look at the bad ones. Alveoli lose their elasticity and shape, making it harder to exhale. Air gets trapped in the lungs, that's hyperventilation or hyperinflation. The bronchial tubes become inflamed and narrowed. Thick mucus forms, causing a chronic cough. Take a look at what your bronchioles look like when you have constant bronchitis or chronic bronchitis due to COPD. Take a look at that. A healthy lung versus a COPD lung. Basically, what's happening is that you have difficulty passing air through your bronchi and you have difficulty with gas exchange. There's an alveoli with emphysema. You see an alveoli that's healthy and normal. So your ability to actually get a good breath of air is going to be very much compromised. Let's take a look at tuberculosis. This is a bacteria. It can cause severe inflammation of your lungs. It can really just cause swelling in your lungs and your lungs to possibly even fill up with fluid. All those little orange critters down there are bacteria. Okay, we got pneumonia. This is where your lungs actually fill up with a fluid. See, there's mucus and pus that can fill in your air sacs, places where fluid should not go. I want to show you guys an actual x-ray of what lungs should look like. And so you have a point of reference. If you look at these lungs right there, that's a great x-ray. On an x-ray, solid, dense objects appear white. If I were to look at this x-ray and I found a big white spot in the middle of the lung, that could be a tumor. Like right here, that looks like a bunch of tumors in the lung. Your lung should be big black hollow spots. Hollow shows up as black. So you can clearly see the lungs in that x-ray. You see the ribs and all the other bones too. The heart is right in the middle. There's the diaphragm on the bottom. And actually that organ right there, those are your liver on the left and your stomach on the right. But when you actually look at a x-ray with pneumonia or COPD, you see a lot of white areas and it's filled up with inflammation and it's even possibly filled up with fluid, which is not good for your lungs. So now let's look at cancer. Doctors are trained to definitely be able to see what a healthy lung looks like and what a healthy lung should not look like. This is an X-ray with cancer in it. You see that these white patchy areas here and here, those are tumors, and that it can be caused spontaneously, but a lot of times it can be caused by smoking. All right, so I'm going to shut down the lesson. What I'm going to get to now is I'm going to talk about the hazards of smoking and vaping as well. Okay,